Welcome, ladies, to our weekly Zoom live stream. How are we, Jessica? You want to say hello? You want to say hello, beautiful?
Hi.
Hi, sweetheart. Do you want
I'm
to
here.
just put your video on? You know, I feed off your faces. I just get a bit of inspo. Hello, gorgeous. How's your week been? It looks warm over
It's been
there.
good.
Yeah.
Yes. Thank you.
Yeah, we're entering spring here in Australia, so we've got the spring winds. It's tumultuous, it's crazy, it sends people a bit crazy. It's like a lot of liberty being, thrown out of whack. So, does anyone else want to say hello to me? Hi, Jamie. Welcome, honey.
Hi.
Hi, sweetie. You want to say hello? Put your camera on. Give me a little wave.
I don't know.
No, not today. There we go.
It's Alexa. Hi. I just sat down, that's why.
Sweetheart, you've got beautiful, is it roses in the background there? What are
Like
they?
my shirt.
No, on the back of the wall there, it looks like pink roses.
Oh, it's flowers. There's a t-shirt with something written on it and then like just flowers hanging, but they're not real.
I love it. Beautiful roses, they light me up. Roses are my favorite. We've got rose bushes here. I've got a beautiful park called the St Kilda Botanical Gardens, and they've got these rose bushes that are just exquisite. They've been there for about 50 years. Anyway, I'm always going and taking photographs of roses. I have a thing for roses, all colors, beautiful. So welcome,
I do
Jamie.
like them, yeah.
Yeah, it's so pretty. So pretty.
Thank you.
Yeah. Gemma, welcome. Do you want to say hello? Do you want to unmute yourself? Give me a wave. Yeah.
I'm just here to learn and see if I can just help my body heal from like years of medications and things to like dysregulate my hormonal cycle, stop my cycle and stuff. And so I've been pretty natural for a long time, but I never did get pregnant at it's like it's a mystery, and now I might be too old, but I just would like to heal that part of me, if that makes sense.
Yeah. Gemma, how long have you been trying?
I am actually have not been trying recently, as I have my other half and I have been off and on, and but I tried for 12 years.
Okay. Wow.
Prior.
Right.
So pretty much all through my late 20s and through my 30s.
Okay.
And now I'm in my 40s.
Okay.
But I feel like the years of the birth control, and I lived in a house with black mold and I was on a lot of steroids and stuff. I didn't have my period most of my 20s or 30s, like the early 30s. I was a vegan and stuff. So I'm just learning to love my body and honor it. And I don't take any medications today. My cycle is like on the clock now.
That's great.
But I had uterine fibroids and I have healed one. I had a big one and it's gone now. I actually gave birth to it a couple months ago. Like just learning to love my body and take care of myself. And kind of connecting the dots, like hormonally, I think that I had a lot of emotional trauma.
Yeah, well, often that's related, and you'll find a lot of benefit from this talk. You're probably applying a lot of the strategies that you've used, but I'm very aware of black mold toxicity. It's quite dangerous, and it's so prevalent, especially in tropical climates. My husband was exposed to black mold toxicity, and he ended up in the ICU. It was crazy. Yeah, very scary stuff. So
yeah, that's what happened. And they put me on a lot of steroids.
yeah.
And I was having I was spotting in between periods. And so they put me on birth control to try to fix it. But it was just the mold was just making me so sick.
Yeah.
And then I tried the vegan thing for a long time. You can see that I've got like red rashy cheeks. So I'm out of the mold now again and healing. And I'm hoping to just learn from all you lovely people. Well,
Welcome, Gemma. You know, you're in good hands and you're amongst family here. So there's a lot of people that are new. So I want to welcome you all. Hannah, even. There's Yemi and there's Vanya. A lot of new people. So I'm going to make a start. So I'm just going to just a few housekeeping notes before we dive in. I want to just remind you to mute your microphones during the presentation. And if you have any questions at the end, what I'll get you to do is stay around to the Q&A, which is at the end. And then when you're addressing your questions, don't throw them in the chat. I want you to turn your cameras on and actually talk to me. I really feed off your faces, all right? And it's a community. I want to build this community. So today we're going to be exploring the crucial topic of progesterone, especially in early pregnancy in the luteal phase. So I'm going to jump right in. We're going to talk a little bit about progesterone. I have spoken about this topic before, but I'm kind of going on a different trajectory. There's so much around progesterone. So first of all, let's talk about what it is. All right. It's a naturally occurring hormone produced by the ovaries following ovulation. And it's literally secreted by the corpus luteum that forms in the ovary after you ovulate. So once that egg's released from the follicle during ovulation, the remaining follicle transforms into the corpus luteum. Now, this structure acts as a temporary endocrine gland and primarily produces the hormone progesterone. So it's often called, progesterone is often called the pregnancy hormone because of the role it plays in helping you get pregnant and maintaining the pregnancy. Now I'm going to break it down why it's called the pregnancy hormone. Well, it helps prepare the uterus. After ovulation, progesterone helps thicken the lining and maintains the lining of the uterus. It also offers support during that luteal phase. So during the luteal phase, if fertilization does occur, that corpus luteum continues to produce progesterone and it keeps the pregnancy viable until the placenta can actually take over progesterone production. It also, progesterone acts as an immune regulation, like an immune modulatory regulatory function. So what it does is it helps regulate the immune response inside the uterus. So what it does is it reduces the likelihood of your body rejecting the embryo because it's often seen as a foreign invader. So we need that immune regulation of progesterone. Now, what also does, finally, it boosts body temperature. So it's considered a warm hormone if you look at Western medicine and from a Chinese medicine perspective. Remember, I'm a doctor of Chinese medicine, so I'm always going to be looking at the lens of this through Chinese medicine. But from both Western medicine and Chinese medicine contexts, you know, it's considered that warm hormone. So what it will do, it will increase your BBT, which is why you see the rise in temperature after ovulation. So for optimal conception, I'm looking for your BBT buds to be between 97.5 degrees Fahrenheit to 98.5. If you're working in degrees Celsius, I'm looking at it from 36.4 to 36.9 during that luteal phase. So you'll see, you know, in the follicular phase, the temperatures are lower. In the luteal phase, they're warmer. That's why we call it a biphasic shifts. All right, and we want to see that on your BBT. Now, this increase in temperature is one of the ways progesterone supports early pregnancy because it's creating a nice, warm, cozy, nurturing environment for your embryo to develop and implant. So in Chinese medicine, progesterone is associated with the yang energy.
Okay.
If you can mute your microphones, that'd be great. So basically in the follicular phase, it's considered the yin phase. So we're always working with yin and yang, the interplay of yin and yang in Chinese medicine. So progesterone is yang, it's warm, it's activating. So what does that do? It's going to help with blood circulation. It's going to help with the endometrial lining. So we're always looking at it in that context and through the lens of yin and yang. All right, so progesterone is yang energy. All right, progesterone levels and the role of the placenta and pregnancy. So the placenta will begin to produce progesterone around 8 to 10 weeks of pregnancy. and that's going to help maintain the environment for the baby. And at this point, the placenta will increase progesterone production to a higher rate than what your ovaries were producing. And then these high levels throughout your pregnancy, they cause the body to stop producing more eggs, which is very important, as well as preparing your breasts to produce milk. So it makes sense, doesn't it? Why we need progesterone. And then your progesterone levels, they'll slowly increase from, you know, your 9th week until your 32nd week of pregnancy. And I'll go through those levels further down. So some of the fertility problems and progesterone testing. So if you're having a hard time getting pregnant, your doctor may recommend a blood test. We call this serum progesterone. It's a blood test for progesterone to see if you are ovulating, because ovulation is the main event of the menstrual cycle. And we want to see if your ovaries are healthy. So this test is usually performed 7 days after ovulation. Now, on which most women, it will be around day 21 if you have a 28-day cycle. But let's remember this, what woman is textbook? I don't know one. So if your cycle is shorter than 28 days, the test may be done on a slightly different day. So that's why it's really, 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 really important to do your BBT charting, because it's a one definitive measure to confirm ovulation without having to do blood serum of progesterone every single cycle, which is, it's pretty costly, isn't it? So, you know, if you can do your BBT charting, ladies, this is a major takeaway. It confirms ovulation, and that way you can see, is the temperature rising? Is it sustained? And then we can track your luteal phase, because we want to see roughly about 11 to 14 days in that luteal phase. All right. So if it's shorter, then there is perhaps an issue with progesterone. So the serum progesterone blood tests, it will provide lots of valuable insights. And it does give you that definitive measure of confirming ovulation. All right, because after ovulation, that corpus luteum, as I mentioned above, it produces the progesterone. And if the progesterone levels are elevated, this confirms that ovulation has occurred. It's that simple. All right, so low or absent levels of progesterone at this point, you're looking at your, you know, serum progesterone blood test, will indicate that ovulation did not happen. So this can be a sign of ovarian dysfunction. So, you know, you might be having anovulatory cycles or ovarian insufficiency. Now, the serum progesterone blood test will also assess your luteal phase function, because we need healthy ovaries to produce adequate progesterone. All right. And if progesterone levels are low, it can indicate that luteal phase defect, like it's a shorter phase. Okay. The serum progesterone blood test will indicate if you do have that hormonal imbalance. And we're always looking at progesterone in relationship to your other reproductive hormones, like your estradiol, your E2. This is your hormones like estrogen. All right. So we want to identify it under the umbrella and in the context of your other sex hormones. But for instance, estrogen dominance, like this is high estrogen relative to low progesterone, may be a sign of PCOS. It may be a sign of endometriosis or other reproductive issues. So, you know, you can see from that serum progesterone test that we can then start to, you know, do some further investigations. So it's a good place to start. Are you ovulating? Yes or no? That's what we need to know straight up off the bat, especially when I'm working with fertility. Are you ovulating? Yes or no? All right. So the types of typical progesterone levels. So we will test it in the luteal phase because we want to see it after you ovulate. Testing in the follicular phase is not going to tell us if you're producing progesterone, is it? So the levels in your follicular phase are very, very low. So they're around 0.1 to 0.3 nanograms per milliliter. All right. So after post-ovulation, remember that's when we have progesterone, post-ovulation, they're elevated. So they're above 10. Just remember that, 10 nanograms per milliliter in a healthy cycle. So we're looking for that in your readings. That's one takeaway, another takeaway for today. In your first trimester of pregnancy, they're significantly higher again. So it's like, here we go. and surge. All right. So first trimester up to 47. So between 10 and 47 nanograms per milliliter. Second trimester, that's when the placenta takes over. Amazing. Like our bodies are incredible. So the placenta takes over in the production of progesterone. So these levels will ensure that you've got proper fetal development. And then it's like, you know, up to 147. So 17 to 147 nanograms per milliliter in the second trimester. In the third trimester, up to 200 nanograms per milliliter. Now, everybody's different, but this is to maintain the uterine environment and prepare the body for labor. That's why we need it. We need those high levels. So when you've got abnormal progesterone levels that are detected, so you've got low levels, then, you know, it's like, okay, is there PCOS? Is there anovulation? Are there irregular cycles? Is there a peri component coming in? You know, are you over the age of 35 and you're in your early 40s? Is there luteal phase defect or ovarian insufficiency? And then by the same token, we can have very, very, very high progesterone levels. So this can be due to, you know, multiple ovulations, as in some cases when you're doing fertility treatments. Clearly with pregnancy, you've got high levels. I've just mentioned those high levels, and less commonly, but, you know, we've got to remember luteal cysts. So they're going to give you those high progesterone levels. But what we want to look at, you know, because we're at home, we want to look for signs and symptoms. So, you know, you want to know, do I have low progesterone? So some key markers that we're looking for, it's spotting, lots of spotting, like before the period, mid-cycle spotting. Okay, spotting's a really big thing, right, with low progesterone. You might have the irregular menstrual cycles because we need, you know, we need the progesterone to support ovulation and, you know, to maintain, you know, that luteal phase. So if you're not ovulating, you'll have irregular cycles. And ovulatory cycles. What else? PMS. There's a lot of PMS with low progesterone because we need progesterone to subside those PMS symptoms. So you might have painful periods, heavy periods, lots of breast tenderness, lots of bloating, lots of mood changes like angry, irritable, you know, people that say, I'm fine. You're so not fine when you say I'm fine. All right. So irritability, depression, anxiety, okay, insomnia, lots of sleep disturbances. But I see with low progesterone, there's a lot of bloating and a lot of water retention. Now, there can be also headaches and migraines leading up to your period. And then the BBT chart, remember the BBT chart, it's the biggest thing to learn from today, is it's going to confirm ovulation. And we want to see that biphasic shift. We want to see the temperatures warmer in the luteal phase. And we also want to see the length of the luteal phase. So it's important that you chart because I want to see 11 to 14 days. You know, under 10, there's a problem with progesterone. That's what we call a luteal phase defect. And you can only see that by charting your BBT. So some of the common causes of low progesterone can include, you know, high stress. High stress, it's the biggest thing. I mean, it's the biggest insidious thing that I talk about in every single live stream is stress. It affects our fertility. So number one is the stress. We've got things like Hashimoto's, so underactive thyroid, hypothyroidism, PCOS, endometriosis. We've got age-related hormonal changes that they start to happen, you know, 35 and above, over 40. You could have elevated prolactin. There can be, you know, beautiful lady that I just spoke to earlier, being on birth control, estrogen dominance, inflammatory conditions, nutrient deficiencies. All right, so we've also got like that, like I said, you're not ovulating, so you've got that luteal phase defect. So you've got improper function of the corpus luteum, all right? And then medical conditions, the cysts, the tumors, and don't forget the gut, our gut dysbiosis. It's so important for our hormones. So when I'm working to optimize progesterone levels naturally, I'm always looking at diet and lifestyle, and these are things that you can use and utilize from today moving forward. We're looking at foods high in vitamin C, foods high in magnesium, foods high in zinc, foods high in vitamin B6. So you all know what vitamin C, you know, it's just like, it's amazing, like oranges, lemons, grapefruits, you know, strawberries, Kiwi fruits. My husband, he loves his kiwi fruits. Bell peppers are great sources of vitamin C. Magnesium, what are good sources? Well, I've got a cacao circle. I often will drink cacao for my fertility patients, but also leafy greens are my #1 source of magnesium. This is your spinach, your kale, your collard greens, anything leafy green, including bok choy. Nuts, almonds, cashews, seeds like pumpkin seeds and sunflower seeds, and whole grains like brown rice and quinoa. So these are magnesium rich. If we're thinking zinc, all right, think of your oysters and beef and chickpeas. Lentils are excellent sources of zinc. If we're looking at vitamin B6 rich foods, this is your chicken, turkey, tuna, pistachios, bananas, and then think healthy fats. We need healthy fats for hormones. All right, so these are your omega-3s. They're found in like all your fatty fish, salmon, mackerel, sardines, avocados, nuts and seeds, olive oil, coconut oil, and then it's avoiding. Now, let's not just reduce this. Let's take caffeine out of the mix, alcohol out of the mix, reduce your sugars. So healthy, like you can have your sugars that come from fruit, natural sugars, but let's get rid of processed, all right? Because with the sugar spikes the insulin, all right, and it negatively affects the progesterone levels. It really is that simple. All right, some of the supplements I might, tailorize for a patient for progesterone support. So, if you're not going to be focusing on the food, because I always start with food. Food is far superior. It's my #1. Then I'll supplement it. So magnesium, all right, magnesium deficiency can hinder progesterone production. So supporting magnesium is very, very important. Magnesium bisglycinate, I've actually got that in my supplement store, drfiona.store. We have omega-3 fatty acids. I've mentioned that, but you can support that with your fish oils, or if you're vegan, you can do your algal oil. All right, probiotics, gut health. I spoke how gut health is linked to hormone regulation. So probiotics support the microbiome, which in turn supports estrogen metabolism and promotes progesterone levels. It's kind of a tiered thing, but we get there. But you can, like if you're doing a preconception multi, you'll have a lot of these things in there, your vitamin C, your zinc, your B6, all right, your magnesium, all right. But other things, Vitex, this is your chase tree berry. It tends to balance your estrogen and progesterone, and it supports progesterone levels. It helps boost the progesterone. Maca, all right, it can support progesterone production. Evening primrose oil I might use. If there is a PCOS patient, I might use inositol, myo-inositol. Inositol helps regulate the blood sugar. Okay, it's going to improve the progesterone production. It also supports ovulation, which is critical for progesterone synthesis. So, then if there is, like, if you're wired, if you've got, things like high cortisol that can interfere with progesterone production, because they're, if we look at cortisol and progesterone, they compete for the same building blocks. All right. So if you're stressed, there's going to be lower progesterone. So reduce the stress, more progesterone. It's fantastic when you can lower the stress. So sometimes I might use ashwagandha. It's an adaptogen that helps balance stress like cortisol, and I might use that if there is adrenal issues and high cortisol, or if there's thyroid disorder. So L-arginine is one other thing I might use. This is an amino acid. It supports healthy blood flow to the ovaries, which can support progesterone levels. So in addition to the subs and the lifestyle, I will then, support things with exercise. Clearly it's going to be moderate exercise. So walking, I call this time on feet, but it's what you like to do. Is it yoga? Is it softball? What is it that you like to do? But do it not at high intensity. So I have, some of my patients, they love the Peloton, and it's like, so I get them to do HIIT. We want high intensity. We want to break it down, like short interval bursts, pull it back, and just pedal the legs, right? You might do some interval sprints, but not at VO2 max. It's not at your maximum. Like, we want to go 80%. When we're in this fertility process of, you know, trying to conceive, we're working on implantation. This is all about moderation. This is following the moderate path and not high intensity exercise. So just do the thing that you love to do: weight training, yoga, Pilates. You know, it's just finding what you love, because joy inspires so much in the body. All right. It's that feel good, serotonin releasing. We've got to feel good and love what we do. Now, sleep. Proper sleep is essential for hormone balance, including progesterone. We want to aim for 7 to up to 9 hours, but 7 to 8. All right, of uninterrupted, ideally uninterrupted sleep, as this is when the body repairs itself and regulates hormone production. And, you know, I said, number one, the impact of stress on progesterone production. So high stress levels, you know, it's going to produce the cortisol, and then your body's under chronic stress. It's going to prioritize cortisol over progesterone. All right, so we want to look at maybe some stress reduction techniques in addition to exercise. So this could be mindset, mindfulness practices, just even 10 minutes of lower diaphragmatic breathing. All right, it could be 4-7-8 breathing. Inhale for 4, hold for 7, exhale for 8. It could be alternate nostril breathing. I'm a yoga instructor, so I'm always teaching meditative practices. It could be just even legs up the wall. Your legs are vertical, 90 degrees. Your torso is on the ground, but this is an inverted leg. We call it Viparita Karani in yoga. You're at a right angle, but what it's doing, it's pulling all the blood into this, you know, into your womb space, and it's encouraging that circulation, but it's aiding the venous blood return back to the heart, and it's calming the nervous system. So it's turning on your parasympathetic nervous system. So just practicing legs up the wall, and I get my patients to do this as a wind down in the evening for just 10 minutes. And you can put an eye bag over your eyes. So I'll often use, you know, even if you don't have an eye pillow, you can use some tissue over the eyes, but you can use an eye pillow, because when you pacify the eyes, we calm the mind. And if we calm the mind and anchor it back into the heart, right, if we become heart-centered, because that's what we need to be when we're working on progesterone, in our heart, not in our heads. And how many of us are in our heads, especially when there's low progesterone? We're up here. We need to be down there. All roads lead to the palace. So yeah, meditation and mindfulness, deep breathing exercise. Even if you can practice 1 minute of present moment awareness, being in the present moment, 1 minute of silence. Close your eyes if you're working, right? Align your spine, sit upright, or even if it's like laying flat, we have this pose in yoga called Shavasana, and it's known as the corpse pose. I know that sounds a bit morbid, but what we're doing essentially in that pose is we are absolutely still. We're in the present. We're letting gravity assist us, and everything gets rebooted and reassessed, and all the hormones and all the meridians become balanced in Shavasana. So 5 to 10 minutes of Shavasana is amazing. But if you're not that kind of person, it could be, all right, some acupuncture. Acupuncture has been shown to reduce stress, especially anxiety, promotes the hormonal balance, and supports progesterone production. It could be, all right, I'm going to step out into nature. You know, use nature as your ally. It's incredible. How often do we actually take the time to sit in nature, particularly in green spaces? Like, earth yourself, ground yourself, put your feet on the earth. So it has a calming effect on the mind. It's literally, it works on those ions, those negative ions. So if we can earth ourselves, whether it's grass, sand, beach, river, you know, immersion into the water, okay, let nature anchor us, because it just works so much on our hormones. But adaptogenic herbs, I mentioned ashwagandha, holy basil, rhodiola, like these help the body manage stress. Clearly, we don't take them once you do have a positive pregnancy test. But if you have really high cortisol and you've got these spikes, you know, peaks, and, you know, if you've done some Dutch testing and we can see your cortisol awakening response is either high or low, then we can use some adaptogenic herbs while you're trying to conceive. We just need to stop them once you're pregnant. But when to consider supplementation, I think this is an interesting topic because not a lot of us talk about it. You know, so I like to do BBD charting. I usually get you to do around 2 to 3 cycles. So I see what your body's doing naturally, because, you know, we want to see a pattern of your BBD chart. So, and if it's less than 10 days after 3 cycles of your BBD charting, we're not getting a significant temperature rise, all right, this can indicate that you've got low progesterone. So this is where I'll send you off for some serum testing to confirm and contrast, and then we might consider some supplementation. Recurrent miscarriages. So if you've experienced recurrent miscarriages, especially in the first trimester, it could be due to insufficient progesterone, okay, to support the lining in the early stages of pregnancy. If you've got the spotting between periods, especially in the luteal phase, all right, that's between ovulation and menstruation, that's second half, all right, could indicate that your progesterone levels dropping too early, making it harder for the fertilized egg to implant, okay? And then just difficulty conceiving, because progesterone helps prepare the uterus for pregnancy by thickening the lining, which I've mentioned at the start. So if you've been trying to conceive for a while without success, low progesterone could be a factor. So hormone testing, blood tests. So I've mentioned the serum progesterone, saliva tests. We've got Dutch testing, which I offer. And you've even got the at-home progesterone tests. You know, you've got the progesterone test kits. So your PDG testing. So this is with Prove or Mirror systems that can indicate levels of progesterone are low in the luteal phase. And that, remember, the test is taken typically on day 21 or seven days after you ovulate. All right, so the types, let's look at some of the types of progesterone supplementation. So we've got oral progesterone pills. All right, I'm going to do a bit of just a very simple breakdown of the most common types. And this is usually prescribed when there's, you know, we need systemic hormone support of progesterone. And it's commonly used, especially in the perimenopause phase, you know, in the over 40s, you know, around 45, 43 and up, maybe sometimes, or very low levels of progesterone. And so basically it's oral, so, you know, it's easy to take, it's widely available. And we've got topical progesterone. So this can come in creams, in gels. So often this is when, you know, it's more mild. The progesterone deficiency is less. You might have PMS symptoms, the spotting, all right, and it's usually bioidentical. So it's just applied to the thin areas of the skin. So usually the wrists, you know, thighs, but it can be anywhere on the décolletage, sometimes even the face. Some of my patients like the smell of the Prove balancing oil. All right, so, you know, it's non-invasive, it's easy to apply. The doses are just a bit harder to control, all right? So, and the absorption can vary between individuals. So that's one of the cons, the pros and cons of it. We've got vaginal or rectal suppositories. These are often prescribed for women that are undergoing IVF, all right, or for those who have a history of miscarriages, and they provide localized hormonal support directly to the uterus. So they are appropriate and they're often prescribed. They can be messy. That's the main thing. Messy and inconvenient. Some of my patients experience a little bit of irritation from the suppositories, but, you know, hey, if it works, let's do it. Injectable progesterone. These are commonly used in IVF. They are prescribed in high doses and intramuscular injections. So they provide really steady high dose of progesterone. Look, you'll need regular injections. The main con with that is that it has to be administered by a healthcare provider. And a lot of my patients, you can self-inject, but a lot of my patients, they find it very difficult to self-inject. So these are some of the cons. But yeah, the pro is that it provides steady high dose of progesterone, which is good. So when to consider each form, I think this is the main thing that we want to talk about is mild deficiencies. If we're looking at that, then we're going to look at the topical creams and the gels. If you've got luteal phase defect, and we've got those short luteal phases or implantation issues, then, we're going to look at the suppositories, or if you've got miscarriages. Clearly, if you're doing IVF treatment, they're already going to take care of this. If you're doing IVF or IUI, they're going to provide you with oral progesterone or injectable progesterone or the suppositories. So that's a given. if you're doing IVF or IUI. And then if you're going through the peri phase, perimenopause, you could look at, you know, a troche or a troche. Sometimes it's pronounced as that, Troche, and it's a lozenge. It's a dissolvable lozenge. It's placed in the mouth. It's sublingual between the cheek and the gum. It dissolves slowly and it's absorbed into the bloodstream. Now, what I like about this is it bypasses the gut and the liver. So it's you know, this is very fast absorption. So this is another way to administer progesterone. So I thought I'd finish with a case study of one of my patients. She was 42. Let me just break it down. 42-year-old, had been trying to conceive for over a year, experiencing irregular cycles, heavy periods. She had clotting, size of the clots, you know, like quite big. Sometimes they were big clots, not just, you know, rice grain, like they were quite big. Mood swings, breast tenderness and bloating. These are signs of estrogen dominance. And she had low progesterone levels. Now because I'm always getting my patients to do the BBD charting. So her luteal phase was 8 days. So, and she also had the mid-cycle spotting. But, you know, her blood tests confirmed her estrogen, her estradiol levels were significantly elevated compared to her progesterone levels. So she had that hormonal imbalance, which affected her fertility. But what she presented with was the irregular cycles, the heavy menstrual bleeding with clots, the mid-cycle spotting, the PMS symptoms, so bloating, mood swings, breast tenderness, and then clearly the difficulty conceiving. So the treatment plan, remember from this is, I'm a doctor of Chinese medicine. The treatment plan, we prescribed Chinese herbal medicine. I prescribed Xiaoyao San. So this was to soothe the liver qi stagnation, a key factor in estrogen dominance. By smoothing that liver function, it helped reduce the excess estrogen and promote a smoother flow of energy and blood throughout the body. I also combined that with, I broke it up into 2 parts, like Buzhong. It's a spleen, it tonifies the spleen, but it has a very amazing lifting function. And it's to help elevate and support the luteal phase by raising the yang energy. So Buzhong. And then I added in things like Baishao, Shudi Huang, Danshan. So Danshan is one of my favorite herbs for clotting. So when you've got especially a lot of that mood swings, Danshan's good for the mood swings and clotting, and it also nourishes the blood. So Danshan is one of my favorite herbs for irregular menstrual cycles. And then Yimutsao, this is Chinese motherwort. So this herb moves blood, it regulates menstruation. It's commonly used for blood stasis issues of clotting and irregular menstruation and PMS symptoms. And then we did acupuncture, weekly acupuncture, working on her liver and spleen. So liver 3 on the big toe, like if you look at your feet, let me show you my feet, big toe, second toe, find those metatarsal bones at the junction is liver 3. We worked on spleen 6, which is the intersection of the spleen, the kidney and the liver, 4 fingers above the inside ankle. So working on liver spleen channels to balance the flow of qi and blood. I worked on Ren 4, which was just at the womb space. I worked on spleen 10. So spleen 10 is one of the primary points for invigorating blood and dispelling blood stasis. So if you look at your kneecap, you go 2 thumb breaths back from that superior border and follow. I usually scrape the knuckles back from your patella towards your groin, and that will activate spleen 10. But it's excellent for menstrual issues. Spleen 10 is probably one of my favorite acupuncture points for this patient and for this condition. We use the kidney points, kidney 3, kidney 6. Look, in terms of her nutrition, we did a hormone balancing diet. I got her on a lot of cruciferous vegetables because they are high in diindolylmethane. It's going to help detoxify that excess estrogen. So this is your brassica family. Your cruciferous vegetables are your brassica family: broccoli, cauliflower, kale, Brussels sprouts, bok choy. They help support the liver and they metabolize the estrogen. So we made sure she had a daily supply of that. Healthy fats, again, all those vitamin B6 rich foods, magnesium rich foods, zinc rich foods, vitamin C rich foods. We also put her on a zinc supplement. I actually got her on a higher dose of like 30 grams of zinc picolinate. She had her PreConception multi, her probiotic, her omega-3s, her magnesium, her CoQ10, and Vitex. So that was her treatment protocol. That was her treatment plan. We also worked on her stress, which was another major component. We got her to do lots of belly breathing, lots of pranayama. I did a lot of alternate nostril breathing for her. So 3 months of treatment. Her cycles were regular. All right. Her luteal phase went from 8 to 11 days in 3 months. Her mid-cycle spotting stopped, which was great. So her periods became lighter and free of clots. Her PMS symptoms, such as the bloating, the breast tenderness, were significantly reduced, almost gone. She also felt calm and more energized. Mood swings were less severe by the 4th month. Okay, so she conceived in her 4th month and carried her pregnancy full term. So I guess the conclusion, I want to kind of do a bit of a wrap up because I want to open up the Q&A. So you can see that with this patient, we addressed the estrogen dominance relative to the low progesterone. We supported it with the Chinese medicine, the acupuncture, the nutrition, the lifestyle, all those adjustments, reduced her stress, everything improved. So closing thoughts, like as today, I think progesterone, I think the takeaway from today, it plays such a critical role in preparing the body for pregnancy, supporting early pregnancy, and maintaining the hormonal balance throughout the luteal phase. And we need that balance. Like Chinese medicine is all about balance, yin and yang. We want to find homeostasis, not relative excess to deficiency. We've always got to bring it back to a homeostasis. And that's the beauty of Chinese medicine. So I want to encourage you to take some of the strategies that I've discussed today. I want you to implement them. So if there's one thing you've learned today, maybe it's charting your BBT. You've never tried it. Download Fertility Friend on an Android or with an iPhone, but download Fertility Friend. The charts are easy to read. You can start to navigate your charts, start to look at your luteal phase. Is it 11 days and above? All right, start to notice any signs of progesterone deficiency. And that way you can, do the testing and know, like you could almost play this back. And, when you get your results, you can look at these and compare and contrast. And then you're empowered. All right. Because I think this journey, it has its ups and downs and you don't have to navigate it alone. All right. And there's tools and there's testing, there's professionals like me and fertility specialists and OBs and OBGYNs. There's so many people you can reach out to, but also holistic practitioners. So just remember the choices you make today can help create a healthier, more balanced tomorrow. So thank you for joining me. I'm going to open up the Q&A. I'm going to answer your questions. So remember, turn your camera on when you are asking your questions. Who would like to ask me a question? Gemma, unmute.
So I've gotten my periods back pretty regularly. I actually just started charting them, especially now that my ex and I have worked out all of our problems and we're back together. One of the things that I've noticed, because I have been focusing on health and doing the restorative things and taking a bath and taking walks, and I've lived in masculine dominant energy for a really, really long time in survival mode. I have had success with this uterine fibroid shrunk and like went away, and I had a really rough period this month and last month, and I think the rest of the fibroid came out. Now it was, when I was in the hospital, it was the size of like a cantaloupe.
Oh.
I looked pregnant, and I was growing them like crazy. Now I'm noticing like a lot of breast tenderness during my periods and feeling kind of emotional or anxious. And I'm not sure if this is just because I'm finally checking in on myself as a woman and doing female things and allowing myself to feel. And so it's like the floodgates are opening, or if because of years of, I was a bodybuilder and strict diets and starving myself, if that is like part of the malnourishment that's coming up. So I'm kind of just curious. I don't want to regrow more fibroids, and I also am healing fibrous cystic breasts. What your thoughts are if I should get tests done, like maybe work with you and get those things done, or just kind of focus on the nutrition and the emotional part, because I feel like not crying my whole life and being very masculine and dominant, like deprived me of healing through tears, if that makes sense.
Yeah. Well, I think it's wonderful that you're tapping into your feminine side. And I welcome tears, because tears are such a release. You know, when we cry, let's start with that. I get my patients to bless them between their eyebrows. They are such, you know, that when you cry, you actually activate your parasympathetic nervous system. So I encourage you to cry and never resist them. Tears are beautiful. That's the feminine, and it needs to speak, and it releases, it opens up the channels. So crying is a great thing. I think that's wonderful you're tapping into that. The key flags for me listening to you is the fibrocystic breasts and these emotional feelings that you're going through. It is tending to suggest that there may be that progesterone deficiency relative to estrogen. It's not to say that it's full estrogen dominance, because you've worked on that, but it might be that, okay, can we do some seed rotation? You know, can we do some of the things where we go, all right, let's look at, is there any plastics in your diet? Like, we want to maybe just balance out those things, because environmental toxins, the xenoestrogens, they mimic estrogens, and often toxicity is a major factor. And you've also told me that you dealt with the mold toxicity.
Yeah.
But in terms of working with me, it'd be an honor to work with you. I'd love to help you navigate this. It seems like you've done most of the work. It seems like, and well done, by the way, because it takes courage, and it's taken time to get to this place. But now you are nourishing your body. You're actually feeling the feels, which is a good sign. But it's when they're out of balance, you know, that, and you're noticing it towards in that luteal phase. So it does suggest that there is a progesterone issue. What I'd like to do is maybe look at your charting, yeah, and see your charts, because you said you've been tracking, you know.
Yeah, I started because I started noticing my period used to come around the 26th of every month. I had a lot of stress in my life. I live in California. We had wildfires. My house burnt down. My dad was murdered. You name it, everything happened. And I was living in a car. There was nowhere to live. Everybody was homeless. And my periods kind of went away for a little while. And then when they've come back off and on. And so I was like, I want to chart it so that I can be aware. Yeah, I mean, I've been having the fibrocystic breast since I was 16.
Oh, okay. All right. So this, I'm terrible. I mean, that's a lot for me to even just digest in that sentence.
Right. That's a lot for me to digest.
Whoa. You know, I just want to give you a big hug, first of all. I just want to, you know, give you a big virtual hug. And breathe, because that's a lot for a little human to go through. So I'm not surprised that you've had this issue for some time. So I'd be looking at, you know, supporting, you know, with even some omega-3s if you're not taking that, or some evening primrose oil. That would be the one thing we could jump on straight away. Secondly to that, I'd be adding in some B6. So look at that if it's in your supplements, if it's in your PreConception multi. If not, you could supplement B6. I like B6 for fibrocystic breasts. And also Vitex, about 400 milligrams daily of that. So that should help you with those PMS symptoms and the mood changes. And we could dose that. I don't go in too high. So Vitex is something that I don't do long term. It's just to bring your body back into balance. That's how Chinese medicine works. We bring your body back into balance. I'll usually do the Vitex. And this is one thing about Vitex. You must have a break. So you will do it from the last day of your period until you get the next period, and you always stop when you are bleeding. So when you're shedding, when you've got your period. So that would be my takeaway from today.
Thank you so much.
You're so welcome. So welcome, Gemma. I look forward to chatting with you more. Are there any other questions?
I just wanted to ask about coffee.
Yeah, go for it. Can you put the camera on? How do I say your name?
Yes.
How do I say your beautiful?
Okay, my name is Einav.
Nav, I love your
Yes.
name. What does it mean?
Thank you.
I
It
love it.
means grape, the fruit in Hebrew.
Love
Yeah.
it.
Um,
Welcome. So nice
so
to meet
yeah, you too. Thank you. Everything that you said about nutrition, I'm working on, but there is one thing that I really like, that is coffee, and I reduced it to one a day. But I really wanted to know
Yeah.
what's the, how it affects the, hormonal balance or fertility in general.
Yeah, okay. It's a great question. All right. There are certain things that I have zero tolerance for, and caffeine is one of them, especially when I'm working over 40, because I have to work harder over 40, right? If you're in your 20s, maybe we could be a little bit more flexible,
Okay.
20 to 30, we can get away with things a bit more. But over 40, right, this is where, okay, I've got to optimize. So I have to go, right, I need to take out any inflammatory markers, because I need stability for you. So what's the attachment to it? Tell me about that.
About coffee?
Yeah, what do you like about it? Tell me what you like about it.
I don't know. It's the taste. I honestly, I did acupuncture, and I remember she told me that it's not good to have it first thing in the morning. And I used to have it first thing in the morning. I used to have it like twice a day.
Okay.
So I reduced it to once a day. And after the acupuncturist told me that it's not good to have it on empty stomach, I am actually starting my day with tea and some lemon in it, and then I work out, and only after my workout I have my coffee. And I don't know, I just like the taste.
Okay.
I stopped for a week, but then I mean, after a few I've been trying to conceive. I mean, I did 2 IVF cycles, and I got out of the first one I had like 6 embryos, but only one came out normal. The second one I had 5 embryos, but none of them were normal. And then the one that was normal didn't stick. So, and I didn't have the means to go through more IVF. So, and I'm doing it by myself. I don't have a partner. So then I tried 4 cycles of IUI, and they were not successful. And I really don't have any more money. And so I kind of stopped, and I'm like, I need to really prepare my body. So it's,
okay. All right. Let me negotiate with you. This is what I do with all my patients.
Okay.
There is no rule that's fixed in fertility, because everything needs to be understood in the context of, everything, right? And this story. So basically, all right, if you love the taste, try Ticino. All right, because if it's the taste you like, Ticino, Tecino, Ticino. It's made from figs and barley and carob and chicory. It takes.
Can I find it in the US?
Yes, you can.
Okay.
Yeah, you can even get it on Amazon.
Okay.
Yeah, Ticino. Now, you're going to love it. It tastes exactly the same as coffee. All right.
Okay.
If I'm working with a patient that wants, likes the lift of coffee, it's Raza coffee, RASA, Raza. It's got the mushrooms and the ashwagandha. It gives you the lift. It gives you that kick. All right. But if you just like the taste, go for Ticino. And we start to, because I think what happens when we say no, we become naughty children. It's like defiance, right?
Right.
That's the nature of us. So whenever I'm working on helping you optimize, I'm going to take it away, and I'm going to give you 6 options. So it could be,
thank you.
it could be dandelion tea. There's lots of different things we can do. Even cacao. All right, we find.
What about dairy?
Yeah,
I mean, I'm okay with giving up dairy, but just because you mentioned the Chinese medicine, and I know they're not big fan of.
I tend to just avoid dairy, partly because most people have gut issues. So when I start working with people, it requires a strong digestion to have dairy. If you do, if I'm not seeing any signs of gut dysbiosis, but let me tell you, nearly every second person I work with has dysbiosis, aka leaky gut, aka IBS. So if you have gut problems, then dairy needs to go. But it's always a case by case, protocol. You see?
Yeah.
And so coming back to the caffeine, then it's just, go slow. Give it a try. Give it 3 weeks, because it takes 3 weeks to create those neural pathways in your brain for change. Don't just do it for 2 days, 3 solid weeks. And then it's like 40 days and 40 nights, and then it's 12 months. It's almost like doing, this 12-step program on giving up alcohol. You see what I'm saying?
Yes.
So
Yes. Thank you so much.
Make it an invitation. So it's not forever, but it's like, what are you willing to change? How hungry are you to change, to improve the outcome?
Right. Okay, well, thank you so much. I appreciate it.
You're welcome. Any other questions? Kayla.
Hi, Dr.
Hannah, here we go.
Hi, Dr. Fiona. I've been following you for a bit, and
Can
it's
you put
quite
your camera on?
fascinating.
Can you put your camera on, Hannah?
Yeah. Hi.
There we go. Hello. How are you?
Hi.
I love your
So I'm
name.
actually feeling, thank you. I'm
It's a
feeling a little
palindrome.
distracted today. I'm sorry. Oh, it's a palindrome, yeah.
Sorry to interrupt you, but Hannah's a
that's good.
palindrome. Hannah's a
Yes.
palindrome. You spell it forward and back. I love it. I love it.
I was just feeling a little dejected today. I do have 3 children, but I wanted a 4th.
Yeah.
And my birthday's coming up. I'm in my low 40s. And I tried the Clomid, I tried the Letrozole, I did the whole route, and I'm not going to do IUI or IVF because it's a lot. It's very expensive, and it's just a lot.
Yeah.
But everything else seems to fail, and I don't know. I'm just not sure what to do at this point.
Okay. Have you tried acupuncture?
So I actually did schedule an appointment for acupuncture for next week.
Right.
For a consult, so I'm going to try that. But I know that my diet leaves a lot to be desired, but it was sort of like kind of the last thing I wanted to do.
Make it your priority. Like, food is our pillar. Like, if we look at it like this, stress is number 1, food is second, right? Because it's how we nourish our body. Hydration, these are really basic fundamentals. But food, make it your focus. Like, from today, what you want to say is not beat yourself up. It's done. But now, you've heard, you can do better. So make food, even it's like, okay, I'm going to work with my acupuncturist, get them to work on a strategy and see, all right, is it an ovulation issue? Is it a progesterone issue? They'll be able to help you.
So I know there's no progesterone issue because I've been monitored.
Okay, great.
And even though it's a little bizarre, but like what you were describing, like I did chart for a bit, not consistently, but I did chart. And I noticed that sometimes my numbers, like you were saying, you should be elevated in your luteal phase if your progesterone is at a good level. But I know I never had a progesterone issue or a lining issue.
Okay, right.
But sometimes my numbers weren't exactly what you're describing.
Okay, that's
so maybe
fine.
Could there be a progesterone issue that doesn't show up in the blood?
And it can be subclinical. So this is where I love Chinese medicine, because it looks at those subclinical issues, right? And that's where we can, in Chinese medicine, like in that luteal phase, we can use things like moxa and work on kidney yang. Like, this is these are the subclinical things we can do, which is warming, like in IVF, they give you warm socks. They don't know why, but it's actually a Chinese medicine, because, Chinese kidney 1 at the bottom of the feet, it goes into the womb. So the kidney meridian, it supports reproduction. And so warm feet are really important when we're in that luteal phase. So we will often do moxa, which is like a cigar. You burn, it's a herb compressed motherwort, moxibustion. We burn it like a cigar close to the feet, and it warms the womb, and it's really helps with implantation. So you can work on the luteal phase with those subclinical signs, and you'll start to see that shift on the chart, like even by adding in moxa in the luteal phase.
But seeing that like the AMH is dropping, and that does that mean that there's no way? Does that mean?
Do you know what, Hannah? You need to listen to last week's live stream. I talked all about AMH. If you are cycling and you're having a regular cycle, AMH, then AMH, don't worry about that sliding scale. It's about the quality. So we want to work on nutrition, because it's the internal environment. right? Once you start to, you know, your follicles start to mature from that primordial pool, it's the environment. What's your environment? Stress, food, nutrition, sleep. You know, it's what those eggs are circulating. It's the internal environment. Let's look at, you know, toxins, help your makeup, your skincare. Like, you know, let's just look at all those things, because we are just being poisoned wherever we go. Can you wash your fruit and vegetables in apple cider vinegar or zeolites, or 1 to 2 teaspoons of zeolites? This is volcanic ash, which helps clear toxins and mold off our fruit and vegetables. Like, these are all things that we can do, right? So yeah, there's look at last week's live stream. But low AMH is not a predictor of your fertility outcome or the quality of your eggs. Don't ever look at that. It's only a test to determine how your body's going to respond to ovulation stimulating drugs. That's all AMH is used for.
Really? But I responded pretty positively. I simply didn't conceive.
Right.
I did have 2 chemical pregnancies on my own.
Okay.
But that, you know, that ended. So
when were they, Hannah?
one was about 8 months ago, and one was, I want to say, like 14 months ago, 13 months ago.
Okay, so, you know, like I mentioned in the talk, you can see that those early miscarriages can be a progesterone issue. So it could be that,
even though the progesterone was fine.
Yeah, you can even supplement it. But we want to see what your chart's doing. I'd like to put my eyes on your chart. I'd like to see some data. Yeah.
Specifically the BBT chart.
Yeah.
So I should start charting again.
Start charting.
And also, one more thing, like Jama said, I actually did have a uterine fibroid that I removed with myomectomy.
Okay.
Also a very large one. That was years ago, so I can only have C-sections, but like, obviously that means that there is some sort of hormonal imbalance that's causing the fibroid. I haven't had one since, but it could still be some sort of imbalance, right?
Yep.
That could be related to infertility.
Yeah, like what I mentioned in the talk, it's that estrogen is high, it's estrogen dominant relative to progesterone low. Even though you're not presenting as progesterone deficiency, there's an imbalance. So we want to correct that. Chinese medicine's amazing for correcting those hormonal imbalances. So yeah, my advice would be to do your acupuncture and see what they say, what your differential diagnosis is, because your differential diagnosis in Chinese medicine gives us a lot of information.
Okay.
Jana.
Thank you. Thank you so much.
You're welcome. Any other questions?
Dr. Hannah.
Yeah,
I have some questions for you.
Great.
Can you hear me?
I'm looking at you.
Oh, okay. I wasn't sure. I want to know, I had a few different questions. I don't know how long you have left, but one question is, right now, I just finished my period like a few days ago, but I usually, for a while this hasn't happened, but I'm having like the spotting after it, and I get a little bit before often, and a long time ago I used to get it in between too. So now I'm thinking, like you said, it's probably low progesterone. So I didn't know that.
Yeah.
But like right now, I was wondering if you're familiar with the bladder drug, Vesicare. I don't know the other name. It's like S something, like Solo something.
No.
Because I'm taking that, and I was wondering, I was just thinking to myself today, I wonder if it's because of that medication, because I recently restarted it.
Can you write it write it in the chat for me? Can you write it? Put it.
Bottle. I'll have to send you a message because I have to see the.
Okay,
I know the Vesicare name, but I don't know the other name.
If you send it to me, let me do the research for you, because then I can actually give you some feedback. What's the question with regards to?
Well, I was wondering if I just thought of it myself today, like if that could be causing spotting, or like, because it's kind of like my period ended, but it kind of didn't, because they're still spotting for like 3 days or more. I'm not sure.
Okay, let me look at
and like some cramps.
Let me look at the drug interactions. I would have to research it. Remember, whenever you're taking medications, there are potential side effects. Like there is.
I know, I hate it.
Yeah, absolutely.
Yeah.
So I'm unaware of the drug, but I will research it for you. More than happy to.
Okay. One of the other things is I actually just had some different tests done, some blood work and some other tests too. But the blood work, when you were talking, I was just looking at it because I had it on my desk anyway. So I don't actually remember. I'd have to look at my calendar to see when exactly it was done through my cycle. I just kind of, I think it was done a few days after my period or near the end of my period, actually, I think.
Yep, that's
But
right.
where it says, it says progesterone plasma,
Mm.
and it says 1.
That's right. So that's
That's low.
in the follicular phase, right? If you remember in the talk, in the follicular phase after your period, we don't have, it's very, very low. Okay. So progesterone
So
rises
it's,
after you ovulate. So we need to do,
oh, okay.
so you often your reproductive hormones, your estradiol, your FSH, your LH, it's all done in your like day 3, day 4. It's done in your follicular phase. Your serum progesterone needs to be done 7 days after you ovulate to get the correct reading. Does that make sense?
Okay.
So that
Yeah, I think
result
I
is
heard you
actually
say that.
that result is actually normal for the
Oh,
follicular phase. Yeah. Yeah.
good. I was like worried about that.
There you go.
So the other thing about testing it is in the last month, I was doing some of just like the stick tests for the ovulation. And I don't think I ovulated this month because when I did it, I didn't see it at all. So I think I did enough tests, but I'm like, I think I just didn't. So I was wondering, because I don't know how to do the BPT charting. Like I don't know how to do the temperature thing because of my problem with the waking up all the time to pee and stuff. I'm worried that it won't be accurate.
Okay, so temp drop is what I recommend to my patients when they've got interrupted sleep, because when we do BB charting, we want to have about 2 to 3 hours of uninterrupted sleep. So temp drop is just an arm monitor. Yeah, temp drop. Highly recommend that.
Mentioned it before. Did
Yeah,
like
right.
on because I honestly do wake up pretty much like sometimes it's like every hour and a half to 2 hours, and I don't even go to 3 hours
Yeah,
in a row
yeah,
all night.
yeah.
It
So
will still take a reading.
it'll take the average, yeah, of your basal body temperature at rest. Yeah, so it takes the average. It's fantastic. It'll give us data, and then you just from that average, you just put that into your BBT chart, mark it in the temp, like in Fertility Friend, and we start collecting some data. So my advice would be get the temp drop in. And then, like, I've got one patient at the moment, and she is just blown away because she can finally see her cycle, because she was really, had her interrupted sleep, and we can finally see what her charts are doing. We're optimizing, things are coming into alignment for her, and she's like, I'm learning so much. Like, the chart tells us so much about your reproductive hormones. Because our hormones, like if you look at estradiol, it rises just before ovulation, and then we have a secondary rise in the luteal phase. So you can see that on the chart. Often it's mistaken as an implantation dip, but what happens is, when estrogen surges, the temperature drops. So we see that on the chart, and I have a lot of my patients say, oh dear, my chart is bad. Oh, it's dropping. No, I'm like, no, estrogen surging, it's what it's meant to do. It's actually good. So it's really awesome to become BBT experts. Once you know what you're looking for, all right, so my advice is to get the temperature up, let's get some charts, let's get the data. And I'll do the research on your
data.
Data.
Yeah, the other thing I was gonna say is for now, I'm in a phase in my life where I'm kind of like the last few weeks, I'm like, okay, you know what? I need to settle down and just work on being healthy, like just healthy and not even think about much else, like just everything else out of the way, just work on because like I'm like from your view of me, you can't tell, but I'm like really overweight, like really, really overweight. Like my face doesn't show it. Like I'm like over 350 pounds, so that's not healthy. And I know that has to go down, and so many things will go down, like the inflammation level, the cortisol level, because I am always so stressed, and that's a big stressor for me. So I'm just like, I know those things are just off balance, and they're throwing other things off balance.
Well, but start with you. I mean, this is what I get my patients to do. Loving kindness. It has to start with love.
Right.
Increase the dose of love, and we start with the simple things. I call it controlling the controllables. So what can you control? Well, you can control when you go to sleep at night. You can wake up and have your lemon water with your apple cider vinegar and your lemon water. You can control going for a walk. Those are the little things that you just implement. Make it an invitation, then start slow, and then it's like, all right, eating well, right? Make it nourishing. you've looked at some of the things, the magnesium rich foods, omega-3s, like break it down into
Yeah.
simple things. Have I got protein, carbs, fats? Where is that on my plate? All right, that ratio. Yeah, and then think of your abdomen is your like two fists. All right, it's the size of your stomach is two fists joined together. So literally, all right, portion sizing. That's why I tend to overeat. I'm like a little piggy wiggy. I have to think always. My best friend is my trainer, and she's a bodybuilder, an international pro, and she says, put your hand next to your plate. And so, because I was just eating like a man, like eating big portions. And so she got me to photograph my food, and I did a food diary. And I think when we just can look at it and think diversity, because your hormones need diversity. We don't want to eat the same things over and over again. We want to think a rainbow of color. Like think of 30 different foods. This is how I try and think of it simply. Think of 30 different foods that you've eaten in this week on your plate. Can you think of 30 different things? Like count them up and go, that's what your microbiome needs. That's what your hormones need. Yeah. Yeah.
Okay, that's hard.
It is hard. I know. It really is. It's a challenge. So go slow, more loving kindness, but lots of breath work. So even start going to sleep at night, because how you go to sleep sets up your subconscious mind. All right. So go to sleep with love in your heart. Think about a future time and place where you're with your newborn. And it can be just thinking with all of your senses alive. What can you smell? What can you taste? What can you touch? What's tangible? And start to think, because your subconscious mind doesn't know the difference between now and the past and the future. All right. But we're going to move towards it. And if you can call it up every night by just placing your hand on your heart, hand on your belly, and dream and immerse yourself in almost a wonderland in your imagination, but use all your senses. I can smell strawberries. I can taste cacao. I can hear the bird singing. My lullaby is Twinkle, Twinkle, Little Star. So start singing that little song at night. You see, like it's a romance. Like fertility is about love. It's born out of love. It's born out of joy. And most of us, when we're doing this process, we're so far away, we're in fear. All right. So I want you to come back to love. Thanks, Jamie. All right, ladies. I think that's going to conclude our session for the week. Thank you for all the new attendees for joining me. I am offering these talks weekly, so please jump in weekly at the same time. It's the same link, and you're more than welcome. I will love and leave you. I'll see you next week.
Dr. F, before you go,
yes,
can you send me your cheat sheet on Skype, please?
Of course I can. Of course I can.
Oh, thank you.
You're welcome. My love. See you later.
Bye.
Bye.